Right, and so are illnesses. And this year it could be the dreaded trifecta: colds, flu, or COVID. Dr. Janice Coffin and Dr. Reggie Benson from AU Health are joining us this morning to shed some light on what to do to prevent one or all of those illnesses I just mentioned.
Hey, good morning, guys.
Good morning. Good morning.
All right, this is good to talk about, especially with fall around the corner. Dr. Benson, what are the symptoms and differences of COVID, flu, or cold?
Yeah, so we'll start with the common cold. So the common cold is a viral infection typically caused by rhinoviruses. And the symptoms there, a lot of times we see sore throat, cough, congestion, and sneezing. And sneezing is pretty unique to the common cold. Now, when we compare that to the flu, you have those symptoms as well. But in addition, you have fevers, chills, headaches. You can get kind of generalized weakness, fatigue, shortness of breath, difficulty breathing, and then vomiting and diarrhea is also associated. And the flu is going to be caused by influenza virus, so again, a viral infection. Now, COVID-19, again, another viral infection caused by coronavirus, SARS-CoV-2, and by and large, those symptoms are going to be similar to the flu, but a big difference there is the symptom of loss in taste and smell, which is something that, we have experienced or we know somebody who's experienced over the few years that it's been around. We've heard that happen pretty commonly. And some red flag signs and symptoms we tell patients to be aware of: just worsening of their chronic disease, really severe dehydration, severe shortness of breath, chest pain. And then for our pediatric population, we tell parents to watch out for high fevers in excess of 104 degrees Fahrenheit. That's not getting better with Tylenol.
You remember when COVID happened and everybody was like, suddenly I can't taste anything anymore. Yeah. That was just a big difference right there. If viewers are feeling those symptoms, what should they do? Is there a treatment?
Yeah, so by and large, if you have an uncomplicated case of the common cold, flu, or COVID, you might not need to seek medical management. Now, if you have high-risk symptoms or some of those severe symptoms that we talked about earlier, if you have any chronic heart or lung disease, if you're currently pregnant, young children, things like that, we recommend that you reach out to your primary care provider. If your symptoms worsen enough, you may want to reach out to the ER or go to urgent care and get evaluated there. The recommendations right now for cold and flu are to stay home for about 24 hours after your fever is stopped. And then for COVID, it's to isolate for 5 days. There's widely available rapid testing for flu and COVID, and the FDA has now approved home testing for both of those as well. And treatment options, so largely it's going to be supportive, that being staying hydrated, resting, taking Tylenol for your aches and pains and fever, and then taking kind of decongestants as well as cough suppressants for some of those symptoms. And if you do seek medical management, you may be given antiviral medications such as Tamiflu or Paxlovid. Again, we're using antivirals because these infections are caused by viruses, not bacteria, so antibiotics aren't going to be helping for those. And again, if you do have any of those high risk factors or severe symptoms, it's better to reach out to your medical provider sooner rather than later.
Okay, that's really important information. Let's talk about prevention so we don't have to reach out to our medical provider, right? Dr. Coffin, what are some things we can do to prevent all of those viruses?
Yeah, so no, that's a great question. So obviously the influenza is here. We're actually seeing both COVID cases and influenza B cases actually in our clinic right now. So it is highly recommended that anyone go ahead and get the influenza vaccine. So most pharmacies will have that influenza vaccine. The other thing is the new COVID vaccine should be available at the end of September. That should cover the new Eris variant. So the influenza vaccine, the COVID vaccine. The other thing is if you're sick, try to stay at home. If for whatever reason you do have to go out, wear a mask, because if you cough or sneeze, you're going to release those viral particles into the air, and then you're going to just, put everyone else at risk. So wear a mask if you're symptomatic. Again, avoid close, sick contacts. Kids are back in school, right? A lot of kids have been sick. So good hand washing, making sure that they have hand sanitizer at home. Again, when your kids get home from school, make them wash their hands, disinfect your home. But again, vaccines are prevention. The influenza vaccine is out there right now, so go to your local pharmacy. Most insurances will cover that at 100%. The new COVID COVID vaccine should be out at the end of September, so please look out for that.
And as you said, the kids are back in school. You always see kind of an uptick in colds and illnesses just because the kids are spreading it all around.
That's right. And you know, kids are going to be kids, and so they're touching their mouth, they're touching their eyes, they're touching you. They eat and drink after one another. So really mainstay is good hand washing, making sure that you're not sharing things. Again, if you cough or sneeze, make sure you do that in the crook of your elbow so that when you do those things, you're not spreading those viral particles out into the atmosphere just for everyone else to breathe in and potentially make them ill as well.
All right, great points. Dr. Benson, Dr. Coffin, thanks so much for joining us this morning.
Thank you, thank you. And quick shout out to Todd Ingram and Jim Mashad. Just keep going to the gym, stay healthy. Everyone be healthy out there. Please be careful. We are seeing an uptick in COVID cases as well as influenza. Please be careful out there. Wear masks if you're sick. If you can't avoid going out into the public, please do. If you're running a fever, stay at home. Don't go to work. Don't go to school and expose everyone else.
And don't go to the gym.
Don't go to the gym.
Thanks very much.